patient is an incredibly important stakeholder in sustainability, one in which there's growing interest, and we absolutely need to engage patients. So this could be at the level of education. If we are thinking about abbreviating a protocol, for example, so generally if you acquire less images or you take less time on a scanner to acquire an imaging study, you tend to use less energy, and that tends to correspond to less greenhouse gas emissions. So
You're taking like MR protocols take much longer, for example, half an hour, 1 hour, 1.5 hours in some instances.
yeah,
But instead you're abbreviating them to use shorter protocols which targetedly answer the question instead of being extremely comprehensive.
absolutely. So some people call those efficient protocols and so forth. And of course, those have other cost-saving benefits in terms of, less time on the scanner, which also might improve wait times and so forth. But absolutely, there's an environmental component to that as well. So let's say you made that decision, and we published on this in Cardiac MRI. What happens if we abbreviate our MRI protocol? How much energy do we save? How much cost does that translate to? Well, let's say you have a patient who's coming back for an MRI and they notice, hey, my booking time is 15 minutes shorter than it used to be. One of the key things that we can do to engage patients is to provide education. You might have an infographic in the patient waiting room. We have made this change. We have shown it doesn't impact on our ability to make the diagnosis or whatever it is that we want to do. And this is how much energy and so forth we've saved. And there's been actually great studies, not specifically in radiology, but in healthcare, showing that if patients are given an option, if there are two choices that would result in similar health outcomes, they, by and large, are motivated to make a choice that's environmentally sustainable.